people are looking for digital solutions. So digital insurance companies are going to grow rapidly. Solutions like ours is going to be the market standard because people won't be willing to submit a claim via fax anymore. This is really old school.
When was the last time you sought medical advice or treatment while traveling? Let's be honest, getting sick or injured abroad is on no one's travel itinerary, and it's often an experience we're woefully unprepared for. Precisely when we're at our weakest, we're forced to navigate a foreign country's healthcare system, communicate with doctors and nurses in what may be their second or third language, ensure that medication we're being prescribed is appropriate, all the while being acutely aware that we're running up a bill that could potentially bankrupt us. Not fun. So, how can you safeguard yourself against the most common medical pitfalls facing travellers? What are the technological solutions promising to revolutionise accessing healthcare abroad? And what's the one thing you should avoid doing if you want to keep away from the doctor's office on vacation? You're listening to Battleface Uncharted, a podcast brought to you by Battleface Travel Insurance. We speak to some of the travel industry's leading figures to discover the trends you need to know about. When it comes to accessing medical treatment on foreign soil, few companies understand the pain points better than healthcare startup AirDoctor. Founded in 2018 with a mission to provide a tech solution to age-old issues, AirDoctor connects travellers with licensed and verified medical professionals for video or face-to-face consultations at the touch of a button. And because they work with insurance, emergency and medical assistance companies and more, they can handle payments directly, meaning travellers don't have to worry about settling bills on top of their health concerns. That's why AirDoctor's partnership with emergency travel assistance platform Robin Assist was a no-brainer, allowing Robin to refer travellers to the app or website and connect with a medical professional within minutes from wherever they are in the world. Co-founder and Chief Revenue Officer Efrat Sagi-Ofir comes to AirDoctor after founding clean tech company SunEffect, having begun her career in industrial engineering with Intel. So, Efrat, what's the number one reason for travellers seeking medical treatment overseas?
So mainly it's because when you travel, you go to a foreign country, sometimes the food is different, the water is different, the climate is different, and your body need to adjust for different things. And then you start to suffer from a stomach flu, from maybe just a flu, for just, things that because of the body need to adjust to a different location and different climate and food.
So, I mean, from your experience then, what's the likelihood that a traveller will have a negative experience when they're seeking medical care abroad? And also, what factors kind of impact that likelihood?
So what we see in average, it's between 10 to 15% of the travelers are going to feel unwell during travel. Not all of them are going to look for medical assistant. Some of them will just take an Advil or take a one-day rest in the hotel, or to go to the local pharmacy to get something to painkillers. And out of the 10 to 15% people that are getting sick, we see about 2 to 3% that people that are looking for medical assistant. And as I said, if I'm looking at the full population of people that are looking for medical assistance, 85% of the cases are minor cases, like stomach flu, ear pain, a lot of problem with tooth pain that you need an emergency solution, a broken ankle, some stitches that people need. Those are the minor cases that about 85% of the cases. And then only 15% of the cases are severe cases that people need to be hospitalized or evacuation or repatriation or some kind of operation in a foreign country.
Got you. So, I mean, I suppose that's quite surprisingly high, the 10 to 15%. I suppose one of the issues is then that people generally are not going to know if it is a minor issue which, you know, they can sort of wait out or maybe just see a pharmacist, or whether it is something more severe that they do need, you know, kind of immediate medical attention for.
Yeah, and people mainly don't want to travel. Like if you have a ear infection, you can't travel with an ear infection, or you're afraid that you can't travel with an ear infection because maybe that can get much more worse during the flight. So we have a lot of people, we see a lot of people that are looking for to get medical advice before the flight, just to make sure that they can fly in their current situation. Or even if you have a broken ankle and you're not sure that you can fly and it can get swallowed in the air. So people really feel the need to get some advice before the flight, even for minor cases.
Of course. So, Efrat, you must hear some, you know, horror stories from travelers who have had, you know, negative experiences. You know, they've got ill abroad. Maybe, you know, they haven't been able to get the advice or the assistance that they need. Any that spring to mind?
I can start first of all with my personal story. I was just before we started a doctor, I was traveling to Spain with my family. We did a very nice hike in Spain. It was in the mountains, and when we went back, my daughter cut herself just near the eye. She was young, and you know, near the eye, it's really bleeding. So it looked horrible. It wasn't, at the end of the day, it wasn't so horrible, but the way it looked, and she was bleeding heavily and we didn't know what to do. And you really, like, you feel so insecure because you're in a foreign country, you don't speak the language. So I don't know Spanish. My husband doesn't speak Spanish. We started to Google, find a solution where we can go. All the results were in Spanish. We called the insurance company. They told us to go to the hospital. And you know, you are 5 p.m. after a long hike, and the last thing you want to go is like spend 8 hours in the emergency room. We tried to ask around to see if we weren't sure if we need stitches or not. And the experience was really horrible, and especially the feeling that you're helpless. Like we didn't know what to do, and we were sure that we need to do something. And you don't want her, like she was very young, you don't want her to get anything, you know, badly on her face that will look bad when she will grow up. The end of the day, we went to the hospital, and it was a very long experience and not pleasant and expensive. And so this is just, you know, my minor situation, but I know that many people, the worst thing is to have a language barrier, because even if you call the clinic and you have the machine answering you and you need to know if to press 1 or 2, but you can't because it's in a foreign language, or you don't know where to go, and sometimes you don't know even where are you, you know, you don't know if the clinic is nearby or it's very far away. We had the case, the one that I really remember, it was during COVID, and it was a lady in China. It was really the start of COVID. And it was a lady in China with a baby. She was there by herself, and the baby was very young, 6 months old. And he had very high fever, and she was super stressed. And she called us, and we immediately sent a doctor to her hotel. And she was so grateful because she was helpless. Everything was in Chinese. She doesn't speak Chinese. Her husband was working, so was not available to help her. And the baby had a very high fever. So yeah, I have many stories of people that really feel helpless when they sick while traveling. And I'm sure that a lot of people that listen to us, they will say now to themselves, oh yeah, it happened to me, it happened to my family, it happened to my friend. Every time that I'm talking to people, everyone has a different story about something that happened to them.
Got you. So tell me then, Efrat, how did Air Doctor come about? What's the foundation story here?
Yeah, you know that every good startup company start with a personal story. So I already told you my personal story, but it wasn't the only one. So we are 4 founders, and each one of us has a similar experience, just a different location or different problem. But Yam, one of the founders, he was traveling to Latin America and he went to the hospital, and it was a very, very unpleasant experience. He couldn't understand anything they told him. He wasn't sure that the person that treats him is really a doctor. and he decided to go back home. And Jenny, our CEO, she also had an unpleasant experience in Budapest when she was in a hotel, and the doctor came to the hotel, and she wasn't. He looked so young and unprofessional, so she wasn't sure she's getting the right treatment. So when we all met and talked about this solution, we were all thinking, yes, like how come you can travel, you can order a pizza with pineapple, you can have your Uber, you can have your apartment, but if you look for a doctor, it's really impossible to find a good doctor.
Yeah, and you mentioned that there the kind of uncertainty around whether you should kind of trust this particular doctor or this medical professional. An advantage of Air Doctor's services are the fact that the medical professionals are verified by yourselves. How does that process work?
So let me just a little bit tell about what we are doing. So in Air Doctor, we are connecting between travelers and doctors worldwide. So we have a large network of doctors, 20,000 doctors worldwide, and we provide three types of different solutions. We have clinic visit, that you can go to the doctor's clinic. We have home visit, that you can invite a doctor to come to your hotel or apartment. And we have video consultation, that you can talk to the doctor over the video. And our video consultation is a very unique solution because we provide prescription. And when I say prescription, I mean, it's not like you will talk, if you are from the UK and you're now in Israel and you will talk to your doctor in the UK, the prescription is not going to be valid in Israel. But if you will use their doctor, we will connect you to a local doctor that can give you a prescription that is valid in the local pharmacy. So this is a very unique solution that we have, and we provide it almost worldwide. Yeah, so our most important thing in a doctor is to have a high quality network of doctors. Because if people will use our solution and won't be happy with the doctors, they won't ever use us again. And we understand the stress. We understand the trust that we need to build with the patient in order to make sure that we give them the best medical solution. So we have a large team that everything that they do, they create a community of doctors. We call them doctor community team. And the community of doctors is that we always, first of all, when we hire them, we make sure that they have valid license and insurance. And we collect reviews about the doctors from the travelers. And if we see bad review, we always immediately remove the doctor from the list and do an investigation. So if you go to the app, you won't see doctors with less than 4 or 3 stars. Why? Because we remove them, because this is something that we can't have. We can't have doctors that are not giving the best medical solution. And this is our high priority, to give the most a quality medical solution for the travelers.
Absolutely. So, well, let's talk about those travelers then. I mean, what kind of feedback do you get from the travelers after using the Air Doctor service?
I'm not sure if the audience know what NPS is, but people probably know what Trustpilot is. So Trustpilot, we have a score of 4.8. And the NPS is a very aggressive measurement that I can tell you that for insurance companies, for example, their NPS is negative. Our NPS is 81%, is extremely high. The market average is 43. And I think that the reason that our NPS is so high and the people are so impressed by our solution is because, imagine yourself, this is a true story that one lady told me. She was traveling to New York. You know, New York, her husband was really sick. Oh, he wasn't really sick, but he's a man, sorry. And when they feel unwell, they think that they are going to die. And he really, he was feeling really bad. And then they used our solution, and the doctor came to the hotel, checked him, assured him that he's fine, gave him the antibiotics. and immediately felt better. And then those kind of feedback we are getting from people, because they're saying, I'm nowhere, I'm feeling lost, I don't know what to do, and suddenly someone is taking care of me. I have someone that I can talk to. I can do everything online, or I can call, and I know that someone is taking care of me. And this is really a good feeling, and this is why we see a very high feedback from the audience, from the people that are using us.
Got you. So, Efrat, tell me about the partnership with Robin Assist. How did this come about, and how does AirDoctor fit into Robin's medical assistance efforts?
First of all, we think that Robin Assist is an amazing company, and we see Robin Assist as an amazing partner, growing partner, and really appreciate the partnership. For now, what we are providing is a video consultation with prescription, the way I described it earlier. So everyone that travel from one location to another, he can find the doctor. And for the video consultation solution, you can have a doctor within an hour, or you can choose a specific doctor. It's up to you. If you want to choose a specific doctor based on reviews, or if you want a female or a male, or a different specialty, or you can say, I just need the first medical assistant, and then we can have the doctor within 1 hour. Usually it takes 24 minutes to have the online doctor already available. And in most of the locations in the world, you will also get a prescription. So this is very easy. So let's look at the situation. You have an ear infection, you're talking to the doctor, you don't need to leave the hotel. You can do it in the middle of the night, in the morning, whenever is the right time for you. And then the doctor prescribe, you get the prescription, you go to the local pharmacy, take your medication, and end of the story. Very simple, very easy, very friendly.
And I think kind of what you are doing is then just kind of demystifying this process, a process that people might not necessarily understand, and especially when they're feeling ill or they're injured, they don't necessarily have the the mental capacity to research the medical infrastructure of a country, and this just makes everything kind of much easier.
Yes, and on top of making it very easier, you don't need to pay. So all the hassle of submitting claim, sending the invoice, sometimes you need to fax, sometimes you need to scan and to email and to explain and everything. All this hassle is done because Robin Assist will pay our doctor. We are paying the doctors. For the traveler, is all cashless and claimless, and it's amazing.
Fantastic. Efrat, you must keep a keen eye on the intersection of technology and healthcare. Any trends you can see on the horizon for our listeners?
I think that one trend is very, very clear, that companies, that mainly in the travel arena, people are looking for digital solutions. So digital insurance companies are going to grow rapidly. Solutions like ours is going to be the market standard because people won't be willing to submit a claim via fax anymore. This is really old school. People are not going to be willing to look for a solution with a concierge or to ask the Uber to find them a doctor. They want everything to be very simple to use, to be digitalized. And, it's also personal. You don't want to tell anyone what exactly you have and what kind of doctor you're looking for. So I see that video consultation is already a big thing for people in the home country, but I think that video consultation for travelers is going to grow, and having a solution that you can also get a prescription is amazing, because otherwise you need to have the video consultation and then you need to go to the doctor's clinic to get the prescription. So video consultation with prescription is something that's going to be very used. Digital insurance companies, digital platforms like AirDoctor, that everything done very quickly and easily. All claims, all the manual work, everything is going to be. It's the old world. It's not going to be anymore. It's not relevant anymore.
So finally, Efrat, with you being so engrossed in medical treatment overseas, what would be your one piece of advice to travelers hoping to avoid a visit to a doctor when they're traveling? Avoid the seafood buffet at the hotel, perhaps.
I will say avoid getting bitten by a monkey and take care of what you eat and take care of the water that you drink. And most importantly, don't hesitate to seek for medical assistance because, as you see, it's not people they have this the thing that if I'm sick, it's going to be so traumatized. But I'm saying no, very simple. You have an app within 24 minutes, you can have a doctor talking to you, giving you an advice or prescription. So take care of yourself. But if you feel you need, don't hesitate because we'll be happy to support you.
You've been listening to Battleface Uncharted, brought to you by Battleface Travel Insurance.